Namaste. Myself Dr. Narayan, consulting Ayurvedic Urologist from Nadia, Gujarat. We have our hospital Brahma Ayurveda, which is world's first and only Ayurvedic Urology center as of now. I'm working in the field since almost 22 years in this highly specialized field of Ayurvedic Urology. I'm also consultant to Honorable Governor of Gujarat State. So let me explain you regarding this particular condition called as prostate enlargement or benign enlargement of prostate or benign prostatic hypertrophy. So first of all, the most important thing to know is this is not a disease. Prostate enlarges in every single man's body after the age of 50. It's the result of aging. So prostate is exactly like this. If you see, it is exactly below the bladder. Exactly below the bladder you can see the prostate, which is encircling this tube called as urethra. This is normal prostate. So when it enlarges, obviously when it enlarges it compresses this tube. That affects the flow of urine. At the same time, if you see over here, the bladder base is slanting, going down, so bladder gets empty. In this case, when it enlarges, it pushes the bladder base upwards. So in that case, what will happen? The bladder will not get empty completely. So most of the patients, the symptoms they suffer because of the enlarged prostate are that there is poor flow. Sometimes the flow is interrupted. Then the bladder hardly gets empty. Obviously, if the bladder is not getting empty, that patient has to visit restrooms again and again. That frequency is there, especially the nighttime frequency, which we call nocturia, which is very significant, disturbing the sleep, disturbing the quality of life. Some patients may suffer terminal dribbling, means after passing urine is getting out drop by drop for a longer time. Some patients suffer urgency. Urgency means like once that patient gets the urge of urine, that patient has to rush to the washroom immediately, otherwise urine may get leaked out. So these are the basic symptoms. Now, when the prostate enlarges, commonly in Western medicine they prescribe certain medicines. Now, to know the exact status of the patient, we need to go for certain investigations. To know the exact size of the prostate, the best investigation, which is supposed to be a non-invasive investigation, is the ultrasound sonography of the kidney, ureter, bladder and the prostate. Now, the ultrasound sonography suggests the exact size of the prostate. Along with that, the projection of median lobe into the bladder is also very clearly seen or observed in the ultrasound. Obviously, that sonologist must be an expert to deal with this. Then it also shows the residue, post-wide residue urine, means the remaining amount of urine inside the bladder after passing the urine. So that should be minimal. Ideally, it should be insignificant, means zero. But for in case of prostate patients, it is allowed even up to 50. Then we also need to know the bladder wall. If there is significant obstruction in the passage of urine, bladder has to strain. So because of that straining, sometimes the bladder wall turns little thick. So if the bladder wall is thick, it suggests that the obstruction is long standing. That's the only clinical significance. So these are the things which can be very well determined with the ultrasound sonography. The next thing is the uroflowmetry, the rate of max flow, we call max flow rate or Qmax. This should be at least 15 ml per second. So it's a very routine test, non-invasive test, in that patient has to make sure that the bladder is full and that patient has to pee into a tub which is attached to a PC system. A routine test in urology departments, and that PC system gives a graph. In that, the nature of the graph is also important, and at the same time the most important part of this is the Qmax, means max flow rate. The rate with which urine is getting out of the body, that should be at least 15 ml. So these investigations help us a lot to know. And one more thing, obviously the PSA, prostate specific antigen, that should be normal, because that rules out the malignancy or cancerous growth inside the prostate. If the PSA is normal, then there's nothing to be worried about at all. Now coming back to this, again, prostate size. The normal prostate size is only 20 gram. Obviously, it enlarges after the age of 50, but to be honest, prostate size is not at all important. The voiding function is more important. Voiding function, like the goal of our treatment, whenever we treat a patient with enlarged prostate, the goal is very clear, that the urination, the micturition should be effortless, first thing. Second thing, it should be a very properly well formed stream which is shooting at least little distance away from the body, should not dip down near the feet. Third thing, the bladder should get empty. There should be minimal post-white residue urine. Then the next part is the median lobe should not be that much significantly enlarged. So, and obviously the other symptoms like urgency should not be there, and the most important part is that person should not require the nighttime frequency. Means that person should be able to sleep properly, or that person should wake up to pee during night hardly once or maximum twice. So if we are able to achieve this goal, there's no need of surgery. To be honest, we always recommend all the patients not to go for surgery, because the gold standard for this TURP, for this enlarged prostate, is the TURP, transurethral resection of prostate. But when they perform the surgery, the transurethral resection of prostate, TURP or TURP, unfortunately, after that many patients suffer multiple complications. The first is incontinence, means after surgery most of the patients, their urine is leaking continuously, so that very badly affects the quality of life. Many patients suffer the bladder neck stenosis, the neck of the bladder turns tight, so that again affects the quality of life, again the frequency, urgency, burning, and also it may cause the urethral stricture as well. So it is always better to avoid the surgery. So if we are able to maintain the voiding function back to normal with normal PSA, definitely I would never ever recommend the surgery.